Hello and welcome to the CARE program of the Texas A&M Health Science Center. In this evidence-based practice series, you will learn to critically appraise relevant evidence. I am Margaret Foster, a faculty member with the Medical Sciences Library and your host for Module 4. In the previous module, we discussed evidence-based practice and its 5 steps. In this module, we will focus on Step 1, Ask a well-formulated question. Outlining this section, we will cover defining the question, categorizing that question, and practicing the PICO format to further specify research needs. There are 2 objectives for this module. First, to distinguish between a background and foreground question. Second, to recognize a well-formulated, answerable question in the PICO format. Before focusing on Step 1, let's review the next 4 steps. Step 2, acquire the best evidence. Step 3, appraise the evidence. Step 4, apply the evidence. And finally, Step 5, assess the impact. As the figure depicts, evidence-based practice is a cycle. Looking back at Step 1, for most clinicians, asking a health question arises upon seeing a patient, while for other health professionals, asking a research question may arise from a situation with a population, such as an outbreak in a community or a need for an updated policy. Meet Stacy, a third-year medical student on her pediatric rotation, who is seeing a 4-year-old girl, Alexa, for a well-child checkup. Stacy's attending physician agrees with her diagnosis of thrush and is about to prescribe nystatin orally, his standard practice. However, Alexa's mom comments that it would be difficult to give Alexa medicine 4 times a day. She wonders whether Alexa could take a once-daily medication like diflucan, which she had taken herself for a yeast infection. The attending asked Stacy to find out which medication would work better for Alexa. Stacy thinks for a moment, then she surprises her attending with her response. But before we hear what she says, let's examine asking a health question in more detail. In this clinical encounter, Stacy and her attending physician are defining the health issue presented by Alexa and her mom. When we talk about defining a health issue, we want to frame the question so that it is an answerable question. An answerable question is one that can be framed as a search strategy in order to find relevant information in the published literature. Let's look at another example. In this situation, you are a nurse in a large geriatric clinic where you have noticed that many patients are not taking their medications properly. When you mention this to your supervisor, she asks you to prepare ideas to present to the head of the clinic in 2 weeks. A non-answerable question is, why do patients forget to take medications? This would take a great deal of time to solve and involve a great number of hours of research. An answerable question would be, what are the most effective interventions for improving patient compliance with taking medications? At some point, you could survey the patients and their caregivers to gain a different perspective of the issue, but that's not something you can answer by looking into the published research. Not only do we need to think about having an answerable question, but we can also categorize the question as either a background question or a foreground question. This helps when deciding what form the question will take and selecting appropriate resources. Background questions are those pieces of information that are general knowledge, questions that can be answered by searching a reference or textbook, such as, what are the most common symptoms of breast cancer? Foreground questions, on the other hand, are those more specific questions that can be answered by looking at recent published studies, such as this example. Which is the most effective intervention for back pain of a 40-year-old truck driver? Pain medication or exercise? Resources to search would be PubMed or treatment summary source, such as UpToDate or Dynamed. When asking a foreground question, the PICO format is used to further define the question. There are 4 parts to a PICO form: patient or population, intervention, comparison, and outcome. Population terms include age, gender, and so on, as well as the health issue, such as diabetes or asthma. Intervention is for the intervention being considered, such as a drug, surgery, or policy. The setting for the intervention may also be described here, such as in the patient's home or clinic. Next is comparison. Will you be comparing the intervention to common practice, or perhaps no intervention? Lastly, outcome. Examples include BMI, patient satisfaction, and so on. These are measurable outcomes that would be reported in the literature so that you can compare the interventions and make a decision. Let's look at an example with the truck driver. So we already had a pretty good question, but here we could define it even more by comparing these two interventions on the outcome of less time missed from work. Next, you will try a guided practice with this situation. A hospital administrator is reviewing the budget and wants to decrease the number of health education classes offered by the hospital. One class to be removed is the labor preparation class, which you teach. You need to bring evidence to the next meeting to show the effectiveness of these classes. For the following questions, fill in your own PICO that you will use to research. Click Submit after each entry to view a possible answer. The PICO format is meant to be a guide to help you define a question and options to consider. It is not meant to force you into adding parts into your question that you do not want or need, such as adding a comparison intervention. Back to Alexa, the child with thrush, and her mom. So what would your response be if you were Stacy? Here's how Stacy responded to her attending's request. Dr. House, let me rephrase our questions in PICO format. One question is, in healthy infants with thrush, does a once daily dose of diflucan reduce budding yeast more than nystatin 4 times daily? A second question is, in healthy infants with thrush, does diflucan once daily lead to better compliance than nystatin? Dr. House is so impressed. He then adds, now we need some answers to these questions. The next module will focus on Step 2, Acquire the Best Evidence. At the end of this video, you will be taken to a new web page to complete a short quiz. Thank you for participating in the Texas A&M Health Science Center CARE program. Click on the link for the quiz to complete this module. Thank you.